Hello friends, welcome to my channel Health Rank, and I am Harish Patel. Now today's I tell you about swine flu or H1N1 influenza virus. So let's friends start now. First topic is swine flu facts. Swine flu is a respiratory disease caused by influenza viruses that infect the respiratory tract of pig and result in a barking cough, decreased appetites, nasal secretion, and listless behavior. The virus can be transmitted to humans. Swine flu virus may mutate or changes so that they are easily transmissible among humans. The April 2009 swine flu outbreaks was due to infections with the H1N1 virus and was first observed in Mexico. Symptoms of swine flu is human are similar to most influenza infection. Fever plus 100 Fahrenheit or greater. Cough, nasal secretion, fatigue and headaches. The incubation period of the disease is about 1 to 4 days. Swine flu is contagious about 1 day before symptoms develop to about 5 to 7 days after symptoms develop. Some patients may be contagious for a longer time span. The disease lasts about 3 to 7 days with more serious infection lasting about 9 to 10 days. Vaccination is the best way to prevent or reduce the chance of becoming infected with the influenza viruses. Primary care specialists, pediatricians and emergency medicines doctors usually treat the disease, but other specialists may be consulted if the flu is severe and or complicated. Two antiviral agents like Zanamivir as a brand Influenza and OSeltamivir as a brand is Tamiflu has been reported to help prevent or reduce the effect of swine flu if taken within 48 hours of the onset of symptoms. Some researchers disagree and suggest the antiviral agent have no effect. There are various methods listed in this article to help individual from getting the flu. Next topic is what is a swine flu. So just to start about the discussing about the swine flu. Swine flu is a swine influenza is a respiratory disease caused by influenza virus that infect the respiratory tract of pigs, resulting in a nasal secretion, a barking cough, decreased appetite, and a restless behavior. Swine flu is procedure most of the same symptom in pig as human flu produced in people. Swine flu can last about 1 to 2 weeks in a pig that survive. Swine influenza virus was first isolated from pig in 1930 in the US and has been recognized by pork producer and veterinarian to cause infection in a pig worldwide. In a number of instances, people have developed the swine flu infection when they are closely associated with the pig. For example, farmers or processors. And likewise, pig populations have occasionally been infected with the human flu infection. In most instances, the cross-species infection like swine flu virus to man, human flu virus to pig have remained in local areas and have not caused a national or worldwide infection in either pig or humans. Unfortunately, this cross-species situation with influenza virus has had the potential to changes. Okay, and then how is swine flu transmitted? Is a swine flu and contagious. Swine flu influenza is transmitted from person to person by inhalation or ingestion or droplet containing virus from people sneezing or coughing. It is not transmitted by eating, cooking, pork product. The newest swine flu virus that has caused swine flu is influenza A H3N2, commonly treated H3N2v, that began as an outbreak in 2011. The V in the name meaning the virus is a virus that normally infect only pig but has begun in infect humans. There have been a small outbreak of H1N1 influenza since the pandemic. A recent one in India where last 3 people have died. Then topics, what is the incubation period of swine flu? So the incubation period of swine flu is about 1 to 4 days, with the average being 2 days. In some people, in incubation period may be as long as about 7 days in adult and children. And then what is the contagious period of swine flu? The contagious period for swine flu, swine influenza in adult usually being 1 day before symptoms develop in adult and it lasts about 5 to 7 days after the people become sick. However, people with a weakened immune system and children may be contagious for a long period of time, for example about 10 to 14 days. Then How long does the swine flu last? The next topic is what causes swine flu. The causes of the 2009 swine flu was an influenza A virus type designed at H1N1. In 2011, a new swine flu virus was detected. The new strain was named Influenza A H3N2v. Only a few people, mainly children, were first infected, but officially from US Center for Disease Control and Prevention (CDC) reported increased number of people infected in the 2012 and 2013 flu season. Currently, there are no large number of people infected with the H3N2v. Unfortunately, another virus termed H3N2, not no V in its name, has been detected and caused flu, but this strain is different from H3N2v. In general, all of influenza A virus have a structure similar to the H1N1 virus. Each type has a somewhat different H, N or N structure. And then next, why is swine flu now infecting humans? Many researchers now consider that two main series of events can lead to swine flu, and also avian or bird flu become a major cause of influenza illness in humans. First, the influenza virus type A, B, C are enveloped RNA virus with a segmented genomes. This means the virus RNA genetic code is not a single strand of RNA but exists as 8 different RNA segments in the influenza virus. A human or bird influenza virus can infect a pig respiratory cell at the same time as a swine influenza virus. Some of the replication RNA stranded from the human's virus can get a mistake enclosed inside the enveloped swine influenza virus. For example, one cell could contain 8 swine flu and 8 human flu RNA segments. The total number of RNA type in one cell could be 16 for swine flu, and for human flu RNA segmented could be incorporated into one particles, making a viable 8 RNA segmented flu virus from the 16 available segmented types. Various combinations of RNA segment can result in a new subtype of virus. This process is known as a antigen shift that may have the ability to preferentially infect humans but still show characteristic unique to the swine influenza virus. It is even possible to include RNA strands from birds, swine and human influenza virus into one virus if a single cell becomes infected with all 3 types of influenza. For example, 2 birds flu, 3 swine flu and 3 human for RNA segment to produce a viable 8 segmented new type of flu viral genome. Formation of a new viral type of considered to be antigenic shift. Small changes within an individual RNA segment in a flu virus and terminated antigenic drift, and the result is a major changes in the virus. However, these small genetic changes can accumulate over time to produce enough minor changes that are cumulative after the virus makeup over time. Second, pig can play a unique role as a intermediate host to new flu type because pig respiratory cells can be infected directly with birds, human and other mammalians flu virus. Consequently, pig respiratory cells are able to be infected with many types of flu and can function as a mixing pot for flu RNA segment. Bird flu viruses, which usually infect the gastrointestinal cells of many bird species, are shed in bird feces. Pig can pick these virus up from the environments, and this seems to be the major way that bird flu virus RNA segment enter the mammalians flu virus population. The next topic is what are swine flu symptoms and signs. Symptoms of swine flu are similar. The most influenza infections: fever 100 Fahrenheit or greater, cough usually dry, nasal secretions, fatigue, and headache, with a fatigue being reported in most infected individuals. Some patients may also get a sore throat, rash, body muscle ache or pain, headaches, chill, nausea, vomiting, and diarrhea. In Mexico, many of initial patients infected with H1N1 influenza were young adults, which made some investigations speculated that a strong immune response, as seen in young people, may cause some collateral tissue damage. The incubation period from exposure to first symptom is about 1 to 4 days, with an average of 2 days. The symptom lasts about 1 to 2 weeks and can last longer if the person as a severe infection. Some patients develop severe respiratory symptoms such as a shortness of breath and need respiratory support such as a ventilator to breathe for the patient. Patient can get pneumonia, bacterial secondary infection known as if the viral infection persists, and some can develop seizures. Death often occur from secondary bacterial infections of the lungs. Appropriate antibiotic need to be used in this patient. The usually mortality as a death rate of a typical influenza A is about 0.1%, while the 1918 Spanish flu epidemic has an estimated mortality rate ranging from 2 to 20%. Swine flu, H1N1 flu in Mexico has about 160 deaths and about 2500 confirmed causes, which would corresponding to a mortality rate of about 6%. But these initial data were revised and the mortality rate worldwide was estimated to be much lower. Fortunately, the mortality rate of H1N1 remained low and similar to that of the conventional flu. Next, friends, what test do healthcare professionally use to diagnose swine flu? Swine flu is a representative diagnostic clinically by the patient's history of associational with people known to have the disease and their symptoms listed above. Usually, a quick test, for example, nasopharyngeal swab sample, is done to see if the patient is infected with influenza A or B virus. Most of the tests can distinguish between A and B types. A test can be negative as no flu infection, or positive for type A and B. If the test is positive for type B, the flu is not likely to be swine flu. If it is positive for type A, the patient could have a conventional flu. If it is positive for type A, the person could have a conventional flu strain or swine flu. However, the accuracy of this test has been challenged, and US Center for Disease Control the Prevention has not completed their comparative studies of this test. However, a new test developed by the CDC and a commercial company reportedly can detect H1N1 reliably in about 1 hour. The test was formerly only available to the military in 2010. The FDA approved a commercially available test that could detect H1N1 within 4 hours. Most of these rapid tests are based on PCR technology. And friends, next topic is what type of healthcare professionally treats swine flu. Almost use uncompletely patient with swine flu can be treated at home or by the patient's pediatricians, primary care provided, or emergency medicines doctor. For more complicated and or severe swine flu infections, specialist such as a critical care specialist, lung specialist, and infectious disease specialist may be consulted. And now the discuss about the treatment of swine flu. The best treatment of influenza infection in humans is prevention by vaccinations. Work by several laboratories has produced vaccines. The first H1N1 vaccines released in earlier October 2009 was as a nasal spray vaccine that was approved for use in healthy individual as 2 to 49. The injectable vaccines made from killed H1N1 become available in the second week of October 2009. This vaccine was approved for use in as 6 months to the earlier, including pregnant female. Both of these vaccines are approved by the CDC only after they had conducted clinical trials to prove that the vaccine were safe and effective. A new influenza vaccine preparation in the intradermal vaccine is available. It works like the shot except the administration is less painful. It is approved for age 18 to 64 years. Here, almost all vaccines have some side effects. Common side effects H1N1 vaccines are typical of flu vaccines used over many years and are following. Discuss about the side effects like the flu shots, soreness, redness, major swelling at the short site, muscle ache, low grade fever and nausea do not usually last more than about 24 hours. Nasal spray side effects like running nose, low grade fever, vomiting, headaches, wheezing, cough and a sore throat. And next is intradermal shots, side effects like redness, swellings, pain, headache, muscle ache and fatigue. The flu shot vaccine is made from killed virus particles so a person cannot get the flu from a flu shot. However, the nasal spray vaccine contains a live virus that have been altered to hinder its ability to replicate in human tissues. People will suppress the immune system and should not get vaccinated with the nasal spray. Also, most vaccines that contain flu virus particles are cultivated in eggs. So, individuals with an allergic to eggs should not get the vaccine unless tested and advised by their doctors that they are clear to obtain it. Like all vaccines, event may occur in some rare cases. For example, swelling, weakness, or shortness of breath. About 1% in a million who get the vaccines may develop a neurological problem termed Guillain-Barré syndromes, which can cause weakness or paralysis, difficulty breathing, bladder and or bowel problems, and other nerve problems. If any symptoms like this develop, a physician immediately consult physician immediately. 2 antiviral agents have been reported to help prevent or reduce the effect of swine flu. They are Zanamivir, its brand is Influenza, and OSeltamivir, brand is Tamiflu, both of which are also used to prevent or reduce influenza A and B symptoms. These drugs should not be used indiscriminately because viral resistance to them can end as occurred. Also, they are not recommended if the flu symptoms already have been present for 48 hours or more. Although hospitalized, the patient may still be treated past the 48-hour guideline. Severe infection in some patients may require additional supportive measures such as a ventilation support and treatment of other infection like pneumonia that can occur in a patient with a severe flu infection. The CDC has suggested in their guideline that a pregnant female can be treated with the 2 antiviral agents. Some researchers suggest the data of Tamiflu and Influenza is not correct and suggest the antivirals are not effective. And now friends, we discuss about what is the risk factor of swine flu. Vaccination to prevent influenza is particularly important for people who are at increased risk for severe complications from influenza or at a higher risk for influenza related doctor or hospital visitors. When vaccine supply is limited, vaccination efforts should focus on delivering vaccination to the following peoples since these populations have a higher risk for H1N1 and some other viral infections according to the CDC. All children 6 months to 4 years in 9 months of age. All peoples 15 years of age and older. Adult and children who have chronic pulmonary or cardiovascular, renal, hepatic, neurological, hematologic or metabolic disorder. People who have immunosuppressions, women who are or will be pregnant during the influenza season. Children and adolescents 6 months to 18 years of ages who are receiving long-term aspirin therapy and who might be at risk for experiencing race syndromes after influenza virus infection. Residents of nursing homes and other long-term care facilities. American Indians, people who are morbidly healthcare professional like doctors, nurses, healthcare professional treating patients. Households contact and caregivers of children under 5 years and as of adult 15 years of age and older. With a particular emphasis on vaccinating contact of children less than 6 months age. Household contact and caregivers of peoples with medical condition that put them at high risk for several complications from influenza. Now the discuss about is the possible to prevent swine flu. If the swine flu vaccines or other flu strain vaccines is not readily available, so the say about the although vaccination is the best way to prevent the swine flu, there may be time in the future when the swine flu vaccine may not be available. Currently, there are no shortages of trivalent flu vaccines that contain H1N1 antigens. However, during the 2009 H1N1 pandemic, this situation did occur, so people wanted to know what they could do to protect themselves. If in the future vaccine supply do not meet damage, there are some things people can do to try and prevent infection. Without vaccination, the best strategy is to not allow any virus type to contact a person because quarantining any virus infected people is an extreme measure that may work in some instance. For example, China used this method. But even with quarantining, this virus may still spread by people who have minimal or no symptoms. The next step that is easier to be implemented by individual is for people with the disease to self-quarantine until they become non-infections about 7 to 10 days after flu symptoms abated. Infected people can wear surgical masks to reduce the amount of droplet spray from cough and sneezing and throw away contaminated tissue. Unfortunately, these approaches depend on the compliance of many other people and the likelihood that such method will be highly successful in a prevention flu virus infection at best is only fair. Such method did not stop the 2009 H1N1 pandemic, although they may have some benefits for a few individuals. So friends, that is all about the swine flu symptoms, causes, and that's a treatment like a capsules, Tamiflu, or as a vaccinations. I just discussed about all about the topics, and I hope this video is best for you, and I hope that is a like for you. Now please, if you like, so please share to your friends or other relatives. So his awareness is the best necessary and the precaution is the best as a cure. So if your friends and the family members or others want to know about the swine flu or H1N1 or influenza, this video is best useful for them. So please share it, and if you like this types of video, so please subscribe my channel, and that is all. It's okay. Bye bye. Take care. Have a good day.